Dr. Regine Mathieu, board certified dermatologist and current cosmetic fellow here at Behr Laser and Skincare Center. Thank you for joining our event where we'll be discussing the new FDA approved device to treat acne called the AviClear laser. And this is perfect because June is Acne Awareness Month. Please stick around to the end where there will be a live Q&A with Dr. Behr and I, where we'll be answering all of your questions. And we also have a raffle. If you enter the raffle and you stick around until the end, then you will receive a free Morpheus treatment. And we also have specials where if you purchase a series of 3 AviClear treatments, then you will receive 3 free hydrofacials. The AviClear device is FDA approved to treat acne, and it can range from mild acne, moderate to severe acne, kind of localized on the face. While you can use this device in other areas, they are developing different hand pieces so that we can efficiently and effectively treat those areas. And we're very excited about the results that we've been seeing and to see how this device will improve in the future, because it's had such a huge impact on our improvement in acne for our patients. We are very excited to offer the AviClear laser to treat acne here in our practice. Acne is one of the most common chronic skin conditions, and it has huge psychosocial impacts on everyone's everyday life. And so it's really nice to have a new laser treatment that works so well to treat acne. So the major thing that is so exciting about this device is that it's one of 2 devices on the market now that actually treats acne. So there's nothing really to compare it to. We have a lot of acne treatments. It's one of the most studied conditions that we have in dermatology. So we have a lot of different topical and oral regimens. I think Accutane, which is isotretinoin, is one of the most popular methods to treat very severe acne, and that has side effects that can occur systemically. And this is a wonderful alternative to actually treat those sebaceous glands that contribute to acne without the internal side effects. So this treatment can treat patients of all ages. We typically think of acne affecting adolescents or teens, but in reality, acne affects many people of different ages, young adults, middle age, different changes in your hormone levels, stressors. There's so many different triggers to acne, and anyone is a good candidate. In terms of patients who are under the age of 18, we would require a parent to be present during their consultation and kind of guide them through what the treatment entails and assess the comfort level. So definitely come in for a consultation because this treatment is great for a variety of ages. Today we'll be treating our patient with her 3rd treatment with the AviClear laser, and her problem areas are really the cheeks and the chin, but we will also be treating the full face for her. Now, this device is great for mild to severe acne, and we typically focus on this area, sometimes extending a little bit below the jawline because a lot of people tend to break out in that area. Thank you so much for joining us for our virtual event. Please stick around for our live Q&A with Dr. Behr and I, where we'll be answering all of your questions, so don't hesitate to drop a question in our question box. And just to kind of go over the raffle prizes, if you stick around for the live Q&A, You'll receive a text message, and make sure that you reply yes to receive a free consultation, as well as being entered into a raffle to win a Morpheus 8 treatment.
There it is. Hi, how's everybody doing?
Hello.
Welcome. Thank you for joining us. We're so great to have this new technology that's, medicine free, and also is a long term. Now it's got approved for long term. So we already have a few questions, and we're glad to have you on. And I'm gonna have Dr. Mathieu go through them because she's kind of the expert on this. And when will I see results, and does it get worse before it gets better? So this is a great question, and what do you think about that?
So absolutely we'll see results. There is a variation in results. So the goal of the treatment is to decrease active breakouts, and it's also to improve future breakouts and kind of prohibit it from happening, which is why we like to target those glands that the laser targets. And in terms of the results, as with any time we treat acne, there is a purging stage. So afterwards, it's almost like your skin is purging all of the inflammation and all of the gunk essentially that's forming. And so it does get a little bit worse before it gets better. Typically, patient feedback, each treatment, the purging is a little bit less than the first time, but that is variable.
Yeah, great. And it then gets better and better, huh? Oh yeah, so the special is great for this because we're giving, 3 hydrofacials with a series of 3 treatments. So in between your treatments, you can come in and have a hydrofacial and see our esthetician to help you with those little breakouts that you're getting with that. So that's great. Okay, awesome. Are the results permanent?
That is an excellent question. So in terms of results, acne is a chronic inflammatory skin condition, and there's a lot of different components that contribute to acne. So, you might not have a breakout for a couple of years, and then, there's stress, there's hormones, there's different triggers that may trigger it to come back, but likely it won't be as severe as it was initially. There are patients, even with isotretinoin, that have to go on 2-3 courses, and those are patients with extremely severe acne. So you might have to do extra courses if your acne is to that level and you want to get your skin kind of to a non-breakout stage. But in terms of permanence per se, once your acne journey is over, then it's over. But that's not to say that the results are permanent per se.
So the results, though, do improve after 3 months. They get even better after 6 months. And then now they're showing that they're even better after a year. And then that's why now they got even, they had the approval to treat acne. And now as it's been out longer, they have the approval for long-term improvement of acne. So it is long-term. And as this is out longer, we'll see, what that brings with us. But there is all different stages that have that it gets better and better over the first year after treatments. Here's a good question. How old do you have to be? Can I bring in my 15-year-old son?
Yes, you can bring in your 15-year-old son. I think that, it's really dependent on your child's comfort level. So with this laser, we don't have any topical numbing before. It's fairly, tolerable. Patients have really nice feedback in terms of that. But of course, we want to make sure that they're comfortable, and it will be a discussion, but absolutely.
Yes. And the good thing is like Dr. Mathieu said, we can treat all different levels of acne. So often, acne tends to run in families. So if you have, severe acne in your parents and you start to break out as a teenager, it would be great to treat early so that you don't get to the stage of having any scarring or, any inflammatory areas. So you can treat early. So it's for treating all stages of acne, but it can be treated early if you have a strong family history of severe acne to prevent going through that inflammatory stage with that. Here's a great question. Do I have to do 3 treatments, or can I choose just 1 or 2?
3 treatments are recommended in the series, and a lot of research goes into how many treatments are performed, how patients respond to it. So if you do less than 3 treatments, then you'll likely have a suboptimal treatment, and that's not what we want to offer you. So I would recommend doing the 3 treatment series.
Yes. And the way it is purchased is in 3 treatments, and that is, something that we pay to the company for the 3 treatments. So it is purchased in the 3. It's kind of like Accutane. You're going to get your best results if you need a certain total dosage. So you really want those 3 treatments. Otherwise, it's not worth, just doing 1 or 2 because you're not going to get that permanence. Can it be done on other areas, chest or back, acne? That's a great question, but not yet.
Yes.
So it's really, you want a certain pulses in the area, and they don't have the tip for that yet, but I'm sure the company is working on that, and it will be out, hopefully soon.
Yes.
How soon after my appointment can I wear sunscreen or makeup?
Sunscreen immediately. I would wait about, I'd say about 48 hours, 24 to 48 hours before makeup, but tinted sunscreens go a long way as well. In terms of the downtime, the erythema or redness really goes away by the end of the day. So there's nothing you really have to cover up. It's mostly trying not to add any irritants to the skin.
Does it also help with scars?
It doesn't necessarily treat scars, and we do have a lot of other devices that we can use to treat scars. But this is really to stop the acne from forming the scar. The biggest thing about acne is making sure that you treat it as early as possible, because it's easier to treat acne than to treat scarring. But there are other options for scarring.
Yes, we do a lot of different microneedling radio frequency with Sculptra, and different things to help with the acne scarring. Here's a good one. Is it painful?
So some patients do opt to use Pronox or laughing gas to kind of help with some of the discomfort. Most of the areas that patients typically feel discomfort are the areas that are over certain nerves or certain openings, what we call foramen in the skull, where the nerves do come out. Other than that, it's pretty tolerable. It feels like a little zing, and then most patients say the rest is pretty tolerable.
Let's see. Can you explain why the face was wrapped in the video?
Oh, yes. So before the procedure starts, because we're targeting sebaceous glands, which produce sebum, which is the oily substance that we have in our skin, we do make sure that we degrease the face, which is why we use acetone. We wash the face with Dawn soap, and then we use the gauze, which almost looks like a mummification, if you will. But that's to ensure that the area has a lot of moisture. So we use sterile water before we apply the laser, and that also provides cooling for the skin and moisture.
Yes. Here's a great question. This is a question: does targeting the sebaceous gland cause dry skin and overall faster aging? And this was one of my big questions, and I researched this before, of course, we got the machine. So
yes, so it does not cause overly dry skin. It's really just targeting that sebum production that contributes to that pathway. Now, it might cause your skin to be a little less oily, but it won't cause it to be dry, because we'll still produce that, and there's still sebaceous glands that will be present. We're not eliminating all of the sebaceous glands.
So no, it doesn't cause faster aging. Actually, people really like the way that their skin feels right after the treatments, and it actually has a really nice, glow, and they feel like the texture is good after the treatment, because, it's a certain wavelength that's going to help us. Can you tell me again what the spacing is between appointments and how long each appointment is?
Absolutely. So each appointment will range from about 45 minutes to an hour, and that's mostly for prep time, ensuring the patient is comfortable and getting ready for the procedure. The actual procedure takes about 30 to 45 minutes, depending on the surface area. There is a certain number of pulses that we want to reach for the treatment of the full face to ensure that patients are getting a really good treatment. And we recommend the treatments 4 to 6 weeks apart, 3 treatments total.
Can I get my first AviClear appointment done? Can I quit taking my Accutane?
That's a great question. I would, come in for a consultation, kind of have a discussion, because if you're on the tail end of your Accutane dosing, it might be nice to complete that treatment. Or if you just can't handle the side effects, then definitely come in. This is a really great option or alternative to being on that medication, but it's definitely warrants a discussion with your provider who is prescribing the Accutane, as well as during the consultation.
Yes. Let's see. Remind everybody we're going to get a text afterwards and reply Behr, so you can get consult and you will get entered into the raffle. The special is that if you buy 3 treatments, then you're going to get 3 hydrofacials with that. And I think that's great because they're going to help you, clear your skin and just make you feel even better about your skin, because, it's really hard to have acne. And with that, let's see. Are there any supplements or medicines that would cause any harm or reactions while getting the treatment? That's a great question. Not that we know of, really. I mean, usually for any laser treatment, we have people stop their Retin-A, a little bit before, but, really is not. I have rosacea. Will this help or irritate it, or neither? It's really approved for acne. Really, the mechanism of rosacea is a little bit different. And I don't think they've studied it completely in the rosacea. So we're really not using on rosacea unless it's really a combination of acne and rosacea. So my grandson is currently on medication for acne. Would he continue on it during the process, and how frequent are these done? That's a great question. Often we do have people, if they have severe acne, keep on topical medications while they're on it,
Yes,
right?
yes.
Or give them something just because they're going to have a little bit of that purging. Like we said, it's done every month. But then as, we see the results coming from the AviClear, those medications can be taken off. And, just keep on the topical for sure. And we'll see. Does this make my skin super sun sensitive?
Anytime we're delivering any type of energy or heat energy or any trauma to the skin, your skin is more sensitive to the sun. So we highly recommend using sunscreen and ensuring that after the treatments, you're avoiding the sun to not get any secondary effects.
But it's not like Retin-A that, your skin's then, it's taking off that layer, so it's more sensitive to the sun. Although, we always want people to protect their, skin and wear their sunscreen 365 days. My problem area is chin, jawline, and upper neck. Is the upper neck part of the treatment area?
So technically, we can treat that area. However, in terms of, as Dr. Behr mentioned earlier, the target number of pulses in that area may be sufficient, may not be insufficient, and that might kind of take away from treating other areas. But we can extend it as long as the patient does know that it is kind of an off-label treatment.
Yeah, you can probably go down and not treat as much as the forehead and do that. I still get breakouts after going through Accutane treatment. Will this help with those breakouts?
Yes, absolutely.
Yes.
One of our estheticians, actually, we performed this treatment on her, and she's been on Accutane. She's done a lot of different treatments, and this is the only thing that she said has really helped her after going through everything. So absolutely.
Let's see. Will it aggravate melasma? Great question. I don't think it's
it
there.
Won't aggravate. I won't say it won't, because anything can aggravate melasma, especially if you're delivering heat energy. But we have not seen any, severe exacerbations, and melasma is not a contraindication to receiving this laser treatment.
What are facial regimens after treatment? Do I hold off until done with all treatments?
So that's patient specific and depending on how severe your acne is. In terms of anytime we deliver heat energy, there are a few days before and after the procedure that we do recommend stopping harsher topicals such as retinoids. And you can always go back on it, but because of the intervals, you might be on it for 2 weeks and then off it for 2 weeks, and that's perfectly fine.
Yes, I know we do use other, topical antibiotics and different things. And, if anybody has any more questions, we'll answer just a few more before we're done. There was one question on whether we have subtitles, which I'm not sure, but if you can submit, we can, definitely have you in for an in-office consult, or we could set something. Okay, and this is going to be recorded, and we will post it to our YouTube with subtitles. So it will be posted to our YouTube with subtitles, but we also have the capability. There's a computer app that we use to help with give people appropriate consults when they come into the office. And let's see if there's any more questions. They will get a text, and if you really want to find out more information, want to consult for this great treatment that's a long-lasting treatment for acne, make sure you respond. And then the prize is the Morpheus 8 treatment. So please do that and enter, and thank you all for watching. And we're always here if anybody has any more questions.
Thank you.
Bye. Thank you.